if your legs and your arms kind of hurt a little bit, it could be a sign of peripheral artery disease. And that's just really reduced blood flow in your arteries, I believe, right?
Correct.
Dr. Brian Evans is here to talk a little bit about it and talk about how you can relieve it. Peripheral artery disease is known as a silent killer because you don't notice it?
Well, yeah, peripheral artery disease is the name when we develop plaque or buildup of calcium inside the arteries in our body. What we at CIC are really looking after is buildup of that plaque inside the arteries going down to the legs, which can then lead to symptoms of foot pain, inability to walk long distances, pain in your legs when you lay down at night, or something developing wounds in your feet that just don't heal up.
And what do you do for it?
So we're fancy plumbers. What we do is a minimally invasive procedure. We image the arteries by injecting contrast into those arteries under X-ray, and if there are areas of narrowing or blockage, we can open those up with a little rotor-rooter tool, balloons, or stents if needed.
You do that, I mean, that's what we hear about everybody doing with the heart, right?
Correct.
But you do them mostly with the extremities.
Correct, with the legs, because in diabetics or people in renal disease, developing wounds in the feet could lead to amputation, so we're really focused on the legs.
And why is it called the silent? I mean, if you feel like you can feel this in your arteries and your legs are tired or whatever, why is it called a silent killer?
Silent killer being that if you're developing that kind of plaque in the arteries of your legs, you're building that plaque up in every artery in your body, including the ones in your heart and the ones going up to your head. So you could develop a heart attack from that plaque, or you could have a stroke if something happens in the arteries of your neck. So when we see it in the legs, we definitely encourage further evaluation of the heart and the arteries of the neck as well.
So how do you know when to come in with this?
So you can come in in late stages if you had a wound on your foot and it's not healing up, or if you have pain in your legs, or your legs are just feeling more fatigued or cramping when you're doing your normal walk that you did last year without any issue, but now it's causing you some discomfort and you have to stop and rest. It's definitely time to get it checked out.
And more than pain, it's probably fatigue. I mean, it's just feeling really tired.
Exactly, yeah.
Right?
Fatigue, cramping, just unable to push your legs as far as they used to, then it's time to do something about it.
Good enough. Hey, does anybody have any questions? Anything to say about peripheral artery disease?
Doc, the reason why I'm standing up here, I heard that you were here some time back, and I got a hold of Ty and Agent and Awesome and made an appointment. The ladies treated me with utmost respect. The next appointment was with you. I was pretty hesitated, but they made me relax. When it was all over, you came in, explained in terms that I can understand, and I want to just say thank you, Doc.
Well, thank you for coming to this taping and saying such kind words about our staff. And I'm so happy that we were able to help you out.
And thank you for coming in to answer all these questions here and tell us all about it. Thank you very much. Dr. Brian Evans for coming in today with Comprehensive Integrative Care.